much every visit costs the NHS. Well, Lucy Siegel tots up the figures.
1 in 10 NHS units are asking the government for cash handouts, and many more are struggling to make the required £20 billion of efficiency savings by 2015. Stopping unnecessary visits to accident and emergency would go some way to cutting the soaring NHS bill. Of 12 million visits to A&E last year, it's estimated 6 million needed no treatment. It has been suggested that if patients were presented with an itemised bill at the end of their treatment, they'd be less inclined to trouble the local accident and emergency with relatively minor ailments. But what is the true cost of a visit to the emergency department? As soon as a patient walks through the doors of this emergency department, it costs the hospital £56. This covers the cost of initial triage assessment only, not treatment.
Some people are using the accident and emergency departments, which are quite expensive, for their care for things that could be treated in minor injuries units or walk-in centres, or if they waited and went to general practitioners.
Some healthcare trusts are even considering handing out itemised bills to make patients aware of how much their treatment has cost. Here in Newcastle, like A&Es up and down the country, non-emergencies are costing them a fortune.
Good morning. Good morning. Sarah, Dion, very nice to meet you.
Today, doctors Dion and Sarah are the consultants in charge.
Is it shaping up to be a busy day today, do you think?
It's certainly shaping up to be that way, yeah.
Have you got time to give me a quick tour?
Absolutely.
Okay, brilliant.
Sarah's first patient, Derek Hodgson, arrived by ambulance with an injured ankle. First item on Derek's hypothetical bill is a £250 ambulance journey. His x-ray is done by a radiographer, his plaster cast fitted by a fracture nurse, and then with pain relief on top, this comes to £366. Add a further trip to the fracture clinic, and the total cost spirals to £452. There's no doubt Derek's treatment was an emergency, but doctors argue that some of the more minor injuries can be treated less expensively elsewhere.
Many patients presenting with minor illness and minor injury think that A&E is the best place for them to come. However, there are many other better services available closer to home and actually cheaper as well. We have a 24/7 service to provide, a very expensive infrastructure to underpin that, whereas general practice is lean, it's efficient, and doesn't have to bear the cost of running a 24/7 service.
Alex Westgarth has come in with an ear injury. He's referred to a specialist in the ear, nose and throat clinic. His ear is syringed and dressed, and he's given a course of antibiotics, taking his hypothetical bill to £174.
How would you feel if you'd been presented, in black and white with an itemised bill?
I think people will probably think differently about just coming in every time they get a cover sniffle.
You can feel it really goes in waves here. It's suddenly got very busy. It's quite a charged atmosphere, and the staff are just focused on getting people through the system. I think the cost of treatment is the last thing that's on their minds.
Over in the children's unit, Dr. Dion's been busy.
What sort of cases have you seen today?
We've had a mixture of illness and injury. We've had people falling over and hurt themselves. We've had some snotty children.
Were those emergencies?
Some of them are, some of them are a little bit less so. But I think quite a lot of the time parents just want reassurance, and that's why they come down to get their children checked. Sometimes when we think there are other places you could have gone rather than from here.
And if some patients understood the costs involved, maybe they would go elsewhere. Sarah's patient, John Curley, has come in with back pain. Despite the fact that he's only been treated with painkillers, the cost of this short visit is £84. He's shocked at the price.
Would it put you off if you were given, an itemised bill of everything you've had today?
Yeah, probably, yeah, to a certain degree, yeah. I mean, actually, I was very reluctant to come in the first place, and then to be given a kind of bill of what it's going to cost. Yeah, I'll probably think twice about it.
If we're to be able to sustain the NHS for the future, without taxpayers having to put more and more money in, we need to make sure we get the best value for every pound we spend. And if the public understand how we spend that pound, they can help us do that.
It's shocking that you just don't think of the way that those costs add up. I thought we were both looking at it. It's amazing, amazing. Now, are you the type to rush off to hospital if something goes wrong.